Discover the latest health tips, expert advice, and inspiring stories. This is the Health Channel Podcast. Your journey to better health starts now.
Welcome to Ask the Doc, the show where we encourage our viewers to send in their health questions. I'm Dr. Georgiy Brusovanik, a minimally invasive spine surgeon. Let's start things off with a Facebook question from Gordo. Hey, Dr. B, what are some signs, early signs of spinal problems that people should really be aware of? I'm asking because my older brother, Willie, always played through the pain, which ultimately led to the end of his college football career. Gordo, I'd love to hear how proactive you are being. Early detection of these symptoms can help prevent worsening of these conditions, like herniated discs or spinal degeneration. So it's not a straightforward answer, but we do have 6 signs, early signs, of spinal problems for you to consider. So 1, a twinge in the lower back or neck. A twinge is oftentimes nothing, but those of us who have chronic back and neck pain, they know that with a twinge sometimes comes number 2, which is stiffness, reduced flexibility, number 3, and then difficulty bending, twisting, and little by little, it just turns into a serious episodic problem. Shooting pain down the legs is also a significant early sign because that tells you that there is some nerve irritation. Now, whether it's nerve irritation or compression is very difficult for a patient to tell, with the exception that when there's numbness or tingling in the legs, that's usually more of a sign of nerve compression. And if pain down the leg or sciatica comes and goes, then more often than not, then it's an inflammatory problem rather than something actually compressing the nerve. That's a great question, by the way, Gordo, I appreciate it. So our next question comes to us from Austin. And Austin reached out to us on YouTube. Austin's question is, hey, Doc, my pops played pro hoops and I want to follow in his illustrious footsteps. But that'll only happen if I don't mess up my backup. So what are some of the best daily habits I can include in my daily regimen? Hi, Austin. Thanks for reaching out. I've got a great daily regimen to hopefully keep you on the path to spinal health. So please consider these 6 daily habits to promote spinal health. So 1, maintain good posture. And that being said, a lot of patients sort of blame themselves for having bad posture. Remember that your posture comes from inside, from your skeletal anatomy. Sort of manually overpowering your posture to sit more upright will result in fatigue, and eventually you'll just go back to your normal skeletally determined posture. When I was a little kid, my mom used to stick her thumb up my back so I can sit up straight. Again, you can't really control your posture. There are some habitual elements to slouching, but for the most part, your posture comes from inside. Number 2, stretching every day, especially before game time. Well, look, you got to get the cobwebs out from your joints so that when you play and you ask your body for a lot, your body will be able to deliver without giving you elements of pain. And if you do have some of that terminal joint pain or pain at the end of the range of motion, be sure to stretch even beyond just before a game. Especially with shoulder pain, if you're waking up at night with shoulder pain when you lay on your side, or if you are having pain when you reach behind in a car or reach overhead, those are classic symptoms of adhesive capsulitis, and that deserves some serious stretching. Avoid prolonged sitting. Well, look, that's easy for us to say when you don't have a desk job, but what if you have to sit? So try to get up often, take breaks maybe every 20, 30 minutes. And remember, sitting isn't really what's causing the problem. It's just that with disc degeneration, sitting elucidates that pain. Sitting is how you provoke that pain. But sitting per se isn't the actual cause of the problem. You should strengthen your core muscles, number 5, and that helps support alignment. Now, that's the biggest point in my mind. Think of your spine as a mast on a boat. There has to be a similar or symmetric pull from both the back muscles as well as the abdominal muscles. So it's important to keep your abs tight. Core strengthening sounds complicated. Last, stay hydrated. Well, look, there's very little evidence out there that you can drink your discs to a healthy sort of disc health. But that being said, we do know that dehydration has profound negative effects on all soft tissues. So it would behoove you to stay hydrated as much as possible, Austin. And in general, if you start to have pain, don't just accept it as the new state of life. If you have back or neck pain, get an MRI, get a diagnosis, and get rid of it, as it's so easy to do these days with something as simple as an epidural steroid injection. All right, next question comes to us from Riley. Riley reached out to us on our Instagram page, and her question for me is, hi, Dr. Brusovanik, I'm a 40-year-old guy who plays in both a softball and basketball league with friends, and I've never had a back issue, like ever. Now, I'll admit it, I've put on a couple of pounds lately, okay, maybe more like 30 pounds. And now my back is starting to give me a problem. Could it really be the weight? Riley, carrying excessive weight, especially around the abdomen, does increase the load on your spine. But even though that may be associated with poor posture, with muscle strain, with accelerated wear, there's really no good evidence that adding 30 pounds will have a long-term negative effect on your discs. Now, many patients will report that after they lose weight, their back hurts less. But that could be related to the mode in which these patients lost weight. There's a lot of bias in this sort of retrospective self-analysis. In general, what I see are a lot of patients who are told, I can't help you, you are too fat. And that really bothers me because being overweight does not cause back pain per se. It doesn't cause accelerated disc degeneration. So if your doc is telling you that they can't help you because you're overweight, or if you're told that your back pain comes from your weight, I would really ask you, I would urge you to get a second opinion. That attitude is dismissive, and it doesn't really in any way help you get to a solution, because to those of us who are overweight and have back pain, I want to say that it's very difficult to lose weight. It's very difficult to exercise when you have pain. Jemima sent this question in via our very own website, allhealthtv.com. Jemima asks, hello, Dr. Brew. Brew, I love that. Hello, Dr. Brew. I just turned 55, and my primary care physician warned me that I need to be drinking more water for my back. I've never heard that before. Why do you think he said that? Could it really be true? Jemima, thanks for your question. As it turns out, I too am a big proponent of keeping your body properly hydrated. You'll find that with exercise, dehydration will lead to earlier fatigue, even some emotional changes when you are dehydrated. Now, dehydrated discs shrink, and that's a normal process of degeneration. But whether you drink or not, that isn't really correlated at all with your disc health. There is no study to say that drinking water will further help you hydrate your discs. There really is a true need for good quality research that would look at our lifestyle changes and the rate of disc degeneration. But unfortunately, there still isn't any good quality evidence on that. So I don't want to go against your doc, Jemima, but I would argue that there is no good evidence of drinking in order to support the disc hydration. Alrighty, we've got another question from allhealthtv.com. You should really check out this website when you get a chance. It's chock full of great information. And this question comes to us from Agnes. Agnes asks, hey doc, I used to play drums in a band and toured around the States for a little while. Unfortunately, we were just average, and now I'm an accountant who crunches numbers at his desk all day. Not sure why I shared the info about drumming. That's okay, Angus. It must be something you're proud of. Anyway, I'm starting to get a little pain in my lower back from sitting all day, Any suggestions? So Angus, you came to the right place. I do have some suggestions for you. Sitting pain is very often related to degenerative discs. So if you sit and you have to keep fidgeting and changing positions, if you find that you have difficulty getting out of the car, if you find that getting up from a seated position results in you standing up like an old man, flexed forwards, if you find that walking alleviates your pain and sort of like after you warm up, then that constellation of symptoms is the most common constellation of symptoms. It's usually not a sign of anything dangerous. But if that pain gets annoying enough, you don't have to live with it. So for these pains that come from degenerative discs, a simple steroid pack or a properly targeted epidural steroid injection may just knock it out of the park. Now look, an injection can be into different spots. It can be improperly done. And in my experience, a lot of patients who fly in to see me, they'll say, I've done hundreds of injections. And then we'll try to get the data from their previous docs, and you find that it was a bunch of nonsense. So if you're getting injections and you're not getting anywhere, get a second opinion. But overall, Angus, if you're having pain when you sit, get a lumbar MRI. And if you can't get a doc to look at it, just send me the original, and I'm happy to talk to you and explain what's going on. Now, there are some suggestions for people who sit at a desk all day. And we have 4 of them. Check these out. 1, get a chair that supports the lower back. That means lumbar support, something essentially like a pillow or a bump that's going to keep your back in that semi-normal lumbar curve. Now, sitting in general forces you into the opposite kind of curve. That loads the discs, and that's what causes your pain. But you could circumvent that a bit in the early stages by finding that perfect angle of lordosis. 2, keep your feet flat on the ground. Now, that's a good one because you balance your weight with your feet, and doing that may off-balance your back. It may be just enough to get rid of the back pain. 3, situate your computer screen at eye level to avoid neck strain. Well, that's obvious. And for those who have real problems sitting but are not ready to address the problem, consider a standing desk as well. Finally, take regular breaks to stand, stretch, and walk for a few minutes. Even if it's just a few minutes, even if it's just 3 minutes every half an hour, but that may offload your discs enough, and the pistoning is a lifeline of discs, because the more you move, the more nutrients you pump into the disc proper. So I'm definitely a big proponent of that. This next YouTube question comes to us from Darcy. Darcy asks, Dr. Brusovanik, is there really a correlation between diet and spine health, particularly in terms of bone density? Darcy, I love that question. In med school, there is a common story that we are taught. A woman comes into the ER, an elderly woman who lives alone, and she has back pain. And as a little clue that gets added to the story, there is a word about her having a diet with crackers and tea and nothing else. So that's an example of a poor diet. Darcy, the right nutrition is just as important to the spine as bones, as staying hydrated. So it's important to have a balanced diet. That means foods that are rich in vitamin D and calcium. So if a patient has a poor diet, by the way, same goes for alcoholics, same goes for extreme dieters, bone quality suffers. And we don't really gain much bone quality after our 20s. So you get all that bone when you're young, and then little by little, it just disappears more and more and more. So bone health is essential. And if at this point you're wondering, what state are my bones in? Then the right answer is to get what's called a bone density test. I'm happy to order it for you. It's a simple x-ray, and it really does tell you the state of affairs that when it comes to your bones, and it can let you intervene, which is a rare proactive thing to do, something that will truly make a difference, may even minimize the risk of fracture. Thank you for this really important question, Darcy. Welcome back. Amy just sent us another YouTube question. Amy asks, Dr. Brusovanik, I plan on hitting the gym pretty hard in the coming weeks as I'm preparing for a role in a new TV series. Congrats. I played sports when I was younger and my lower back was a problem pain area. What are the common causes of lower back pain and how can I prevent them? Amy, I'm very excited for you, and I hope that I'm not misjudging your question when I assume that you are either young or middle-aged. If that's the case, a story of problems in the lower back is a bit concerning. Believe it or not, patients who come to see me in their 30s and 40s who say that they've always had back pain, especially pain when they bend backwards. These patients will often say they have difficulty laying on their back, they have difficulty doing certain exercises. They actually have a congenital problem, and it takes about 35 to 40 years for this one particular problem known as spondylolisthesis to come to actually cause patients such severe pain, especially nerve pain, pain going down the legs, that they come in to see the doc. So definitely, Amy, get an MRI before you embark on something different and strenuous. I didn't know we had such a big TV star watching our show. I am excited to help you, Amy, at your service. And in the meantime, those of us who have other questions, please don't hesitate and consider both the YouTube, Facebook, as well as the allhealthtv.com as a way to send us more questions. Our next spine-related question comes from Dawn, who reached out via Facebook. Dawn wants to know, hey, now, Dr. Brusovanik, I play on a varsity tennis team at school, and it's time to start getting back in shape before the season starts. But I think I overdid it last week. How can I tell if I have a herniated disc or if it's just general back discomfort? Dawn, I'm assuming by the fact that you play on the varsity team that you're in high school. It is not normal to have back pain in high school. And just like the previous question, if your pain is worse with certain stretching exercises, particularly ones that force you to bend backwards, like a bridge or stretching after abs, or that big, long, what's called a cock-up, where you bring the racket all the way back when you play tennis. So if you're having back pain and it's getting worse, I urge you to get an MRI, because just like with other parts of the body, no back pain is normal pain. It's a really great question, Dawn, and I would encourage you to not rely on things like Timeline, WebMD, or other sort of extraneous sources. If you are in pain in high school, you got to get some proper imaging to find out why. Well, we have a couple more questions. This one is from Malachi from allhealthtv.com. Dr. Brusovanik, what role does strength training play in spine health? And are there specific exercises that are particularly beneficial? Malachi, that's a really great question. So physical therapy for back pain emphasizes core strengthening, amongst other strengthening maneuvers for neck pain particularly. There are things like chin tucks and lower back stretching that to me are sort of less believable. And then there's basic abdominal strengthening, which can be done laying on your back, literally lifting one leg at a time, which does wonders for your agility, balance, and general alignment throughout the day. It makes it easier to get up from a seated position if your abs are a bit toned. So I'm a strong believer in what's called core strengthening or just abdominal strengthening. Now, earlier we discussed posture. And even though I insist that sort of manual, artificial augmentation of your posture has low chance of actually keeping your posture because your muscles will just fatigue and you'll develop new pain, I do believe that strengthening the muscles between the shoulder blades, particularly interscapular stabilizers, by doing things like terminal extensions with weight, as well as stretching your pectoralis muscle, will result in improved chest out, shoulder back posture. Now, that specific posture is very important because many of us, due to the common way of stooping for a computer, tend to end up with a flexed forward shoulder. And if I may demonstrate by just turning to the side, a flexed forward posture will limit how much you can raise your arms. If you are chest out, shoulder back, you can really raise your arms a lot better. Now, inability to raise your arms all the way up may result in your shoulder becoming tight, and a tight shoulder can present with a typical set of pain, such as nighttime pain when you lay on your side, pain when you reach behind in the car, or pain overhead if you try to get something from the top shelf of your cupboard. So if you're having these kinds of pains, it would be a really good idea to stretch your shoulder. And that's another thing that I highly advise patients who are going to therapy for neck and shoulder to try to address: a tight shoulder. Now, when it comes to a tight shoulder and those symptoms, nighttime pain, pain when you reach, pain behind, I'm going to say something controversial. Now, just going to therapy is not enough. Your therapist will stretch your shoulder, and your therapist has no idea where in your range of motion does the pain begin. Therefore, they are at risk of overstretching, which may cause pain, or they may just baby you because they don't want to see you wince. They don't want to see you in pain. So shoulder stretching must be done by you yourself. Now, if you want to look up 4-quadrant stretching on YouTube, you'll find a number of basic videos. I caution you from using things like rubber bands or weights, because even though rubber bands and weights have a great indication for strength training, that's what they're for. They are for strength training, to build your muscles. And if you have a rotator cuff tear, a labral tear, a biceps tear with a tight shoulder, strengthening those muscles will not help the tight shoulder. So a lot of my patients will get diagnosed with torn labrum or a rotator cuff. They'll undergo 6 weeks of therapy, and then they are told that it's time to go for surgery. They'll have a tight shoulder that hasn't been addressed in therapy, and they'll have a tight shoulder after surgery. The rotator cuff may be perfect after surgery. The biceps may be intact after the tendon gets repaired. Even the labrum can be fixed. Yet they will continue to come in saying that they have nighttime pain, pain about the shoulder when they try to reach, or pain overhead. You will not win if you don't battle the tight shoulder. So my biggest advice to you, Malachi, if you have neck pain, stretch your shoulder and get your abs toned. Thank you for this great question. Okay, the next question is from Aubrey. Aubrey asks, how can smoking affect spinal health? And is quitting beneficial for the spine? Aubrey, I love that question. It's an essential question. There are few areas in medicine that have been researched as much as smoking cigarettes. We know from rat studies that smoking causes quick disc degeneration. We know from human studies that cigarette smoking interferes with tendon healing. We know from human studies that smoking interferes with essentially all soft tissues, from brain function to lung function to muscle function, joint function, cartilage health, and of course, disc health. If there's one intervention that you could do as a smoker that will truly change the outcome of your life, that's smoking cessation. And same goes for the vapes, same goes for any kind of smoking that you do habitually, that you do a lot. Those patients of mine who smoke a pack a day, that's 20 cigarettes. That means that essentially more time is spent in a hypoxic state, being poisoned by nicotine, than not. And it's both the hypoxia from cigarettes and the nicotine that causes all this negative effect on your soft tissue. So Aubrey, I love that question, and I hope that this message really carries far, far. Last question is from Quentin, who sent it via Instagram. Dr. B, how does stress affect the spine, and what can I do to reduce its impact on my back? Quentin, that's a difficult question. You know, blaming stress on your back, in my mind, is sort of the last option. We have to rule out common things that cause organic back and neck pain. And when you are certain that it's not a disc problem or a joint problem or unrelated visceral problems like organ pathology, then we can't just write it off on stress. Now, that being said, if you feel that you are catastrophizing. You feel like your back pain is never going to get better. You're doomed to live like this. There's actually a very interesting article, and if you type in catastrophizing, you'll find that patients who really see their back pain or neck pain as doom, as that they're doomed to suffer, they do tend to suffer more. And with a statistically significant difference, having a positive outcome, which is something you should have, you will see better outcomes. And you should know and believe full-heartedly that there's always a cause to your back and neck pain. And there's usually, almost always, a solution. You just got to start with a diagnosis, see a doc who will examine you, and make sure you know exactly why you're hurting. Once you know why you're hurting, you'll be able to fix this. Thank you again for coming on to Ask the Doc. Please send us questions, and see you next week.
Thank you for listening to the Health Channel podcast. We hope this information has been useful. However, please remember that only your doctor can advise you about what is best for you. Do not start, modify, or suspend treatment based on anything you have heard on this podcast. Please join us again soon.